Last week, I received a message that kept me awake at night. Someone I will not identify wrote to me saying that I should stop talking about food and arthritis because I was hurting medication sales. Did you read that correctly? Hurting medication sales. As if helping people feel less pain was somehow a bad thing. This was not the first time I have received this kind of pressure. I have had speaking invitations canceled because the sponsor did not like what I was saying about nutrition. I have had colleagues who stopped referring patients to me because they thought I was too radical. But you know what? I am not going to stop. My name is Finley Crosden. I am a rheumatologist with over 20 years of experience. And today I am going to tell you about specific fruits that science has proven can reverse arthritis symptoms. And if someone got upset about that, that is their problem. Because my obligation is to you who are suffering, not to those who profit from your suffering. I know you have tried everything. You took anti-inflammatory medications until your stomach complained. You applied creams that promised relief in minutes. You bought expensive supplements that swore to regenerate cartilage. You did physical therapy, acupuncture, maybe even tried some home remedies. And the pain? It is still there. Every morning you wake up with that stiffness in your hands, your knees, your hips. It takes about 20-30 minutes before you can move properly. And during the day, any sudden movement brings that sharp sting that makes you stop in the middle of whatever you are doing. I understand that frustration. I see it every day in my practice. People who arrive discouraged, thinking there is no hope left, that they will have to accept living like this for the rest of their lives. But let me tell you about Harold. He is 71 years old and came to my office on a Thursday morning. I remember it well because he was having difficulty holding his briefcase. His hands were so swollen that his fingers looked like sausages. He sat down in the chair carefully, supporting himself on the armrests because his knees hurt too much to bend all at once. And before I could ask anything, he started talking. Dr. Crosden, I came here because my neighbor said you are different, that you do not just prescribe medications. I take 7 pills a day. 7. 1 for my stomach that the anti-inflammatory destroyed. 1 for blood pressure that went up because of another medication. And 5 more for arthritis that never gets better. My wife passed away 2 years ago. My children live far away, and I cannot even peel an orange by myself. Last Sunday, I tried to make breakfast for my granddaughter who was visiting, and I cried in pain trying to crack the eggs. Doctor, I just want to be able to live without depending on others for everything. His daughter, who had driven him there, added with a trembling voice. Dad does not tell you this, doctor, but I know he sometimes goes without eating properly because it hurts too much to prepare food. I found him eating crackers with coffee because he could not hold the pan steady. It breaks my heart. I looked at the test results he brought. Rheumatoid factor positive, C-reactive protein elevated, erythrocyte sedimentation rate high. All the inflammatory markers were screaming, and he had already seen 3 rheumatologists before me. They had all done the same thing, increased the medication dosage or switched to stronger ones. None of them had asked what he was eating. And that is where what I want to explain to you today comes in. Arthritis, whether it is rheumatoid, osteoarthritis, or gout, has one thing in common: inflammation. Your immune system is attacking your own joints, or it is overreacting to some stimulus. And do you know what feeds that inflammation? What you put on your plate every day. But do you know what can also put out that fire? Exactly. What you put on your plate every day. The University of Leeds in the United Kingdom published in December of 2024 a systematic review analyzing 30 studies with more than 10,000 people. And one of the most impressive findings was this: increasing fruit consumption by just 80 grams per day, the equivalent of a small apple, reduced the risk of developing rheumatoid arthritis by 5%. Does that seem like a small number? It is not. Because we are talking about prevention. And when we look at people who already have the disease, the numbers are even more impressive. I am going to tell you about the fruits that science has identified as the most powerful against arthritis. And these are not expensive exotic fruits that you can only find in specialty import stores. These are fruits that you can find at any grocery store, any farmer's market, at affordable prices. The first one is cherries. This little red fruit is an anti-inflammatory powerhouse. It contains anthocyanins, which are pigments that give it that intense red color and that work in your body like firefighters putting out the flames of inflammation. The anthocyanins in cherries are so potent that some researchers compare their effect to non-steroidal anti-inflammatory medications, but without the side effects on the stomach. A study published in the Journal of Nutrition showed that women who consumed more than 16 cherries per week had significantly lower levels of C-reactive protein, which is the main marker of inflammation in the blood. We are talking about a measurable reduction detected in laboratory tests just from eating cherries regularly. Another study from the Baylor Research Institute followed patients with knee osteoarthritis for 8 weeks. Those who consumed cherry extract daily had improvement in pain and joint function compared to the group that did not consume it. 8 weeks, 2 months. Pain reduced. Ability to walk improved. Without any side effects. But that is not all. Cherries also help lower uric acid levels in the blood. And high uric acid is what causes gout, that type of arthritis that causes terrible pain attacks, usually in the big toe. Researchers at Boston University found that people with gout who consumed cherries regularly were up to 50% less likely to have an attack. 50%. That is more than many medications can achieve. The information you are receiving right now could change your life. And I need you to do something. Hit that like button and subscribe to this channel. When you do that, you help this knowledge reach more people who are suffering in silence. So go ahead, like and subscribe, and let us continue. The second powerful fruit is strawberries. Like cherries, strawberries are rich in anthocyanins. But they have an extra advantage. They are one of the best sources of vitamin C among all fruits. And vitamin C is essential for anyone with arthritis for 2 reasons. First, it is a potent antioxidant that neutralizes the free radicals that damage joints. Second, it is essential for collagen production, which is the protein that forms cartilage. Without enough vitamin C, your body cannot repair the cartilage that is being destroyed by inflammation. Strawberries are also a source of folic acid, and this is especially important for anyone taking methotrexate, which is one of the most commonly used medications for rheumatoid arthritis. Methotrexate depletes folic acid from the body, and strawberries help replenish it naturally. The third fruit is pomegranate. This ancient fruit, which appears even in biblical texts, has surprising anti-inflammatory power. It contains punicalagins, which are compounds that inhibit the enzymes that destroy cartilage. A study published in the Journal of Nutrition found that pomegranate extract significantly reduced inflammatory markers in patients with rheumatoid arthritis. Another laboratory study showed that pomegranate compounds were able to block the action of substances that cause cartilage degradation. It is as if pomegranate puts a protective shield around your joints. The fourth fruit is avocado. I know many people consider it expensive, but let me explain why it is worth every penny. Avocado is rich in monounsaturated fats, the same ones found in olive oil, which are anti-inflammatory. It also contains lutein, an antioxidant that fights the free radicals that damage joints. And there is more. Avocado is one of the few fruits that contains vitamin E in significant amounts. Vitamin E works together with vitamin C to protect cells from inflammation. A French study showed that people with higher vitamin E consumption had slower progression of osteoarthritis. You can eat half an avocado per day, or use it in salads, or make that delicious guacamole. The fifth fruit is watermelon. It is composed of more than 90% water, which already helps with joint hydration. But its secret lies in two compounds, lycopene and beta-cryptoxanthin. Lycopene is the same antioxidant found in tomatoes, but watermelon has it in even higher quantities. It reduces systemic inflammation in the body. And beta-cryptoxanthin is a carotenoid that studies have associated specifically with reduced risk of rheumatoid arthritis. A study published in the American Journal of Clinical Nutrition followed more than 25,000 people for years and found that those with higher beta-cryptoxanthin consumption had significantly lower risk of developing inflammatory arthritis. The sixth fruit I want to mention is grapes, especially purple grapes. They contain resveratrol, a polyphenol that became famous for being present in red wine. Resveratrol has proven ability to reduce rheumatoid arthritis activity in scientific studies. It works by suppressing synovial inflammation, which is the inflammation of the membrane that lines the joints. It also inhibits enzymes that degrade cartilage. You do not need to drink wine to get this benefit. Eating purple grapes with the skin or drinking whole grape juice without added sugar already provides a good amount of resveratrol. Other compounds in grapes, such as quercetin, have also shown positive effects on inflammatory markers. Now I want to hear from you. Which of these fruits do you already eat regularly? Which one are you going to start including in your diet? Leave a comment below. I read the comments, and it helps me create content more specific to your needs. Going back to Harold. When I explained all of this to him, he looked at me skeptically. Doctor, are you telling me that eating fruit is going to solve my problem? I have eaten fruit my whole life, and I am in this condition. I explained that it was not about eating just any fruit in any way. It was about including these specific fruits in the right amounts, consistently. And more importantly, it was about stopping eating some things that were throwing fuel on the fire of his inflammation. Because just as important as what you eat is what you stop eating. Refined sugar feeds inflammation. White flour turns into sugar in the blood quickly and feeds inflammation. Trans fats, present in processed cookies and cheap margarines, feed inflammation. Soda, with all that sugar and phosphoric acid, feeds inflammation. Processed meats, like hot dogs, ham, and bologna, full of preservatives and sodium, feed inflammation. If you eat these things every day and throw a cherry on top, it will not help much. You need to clear the ground first. I put together a protocol for Harold. Breakfast, a bowl of red fruits with oatmeal and a handful of nuts. Strawberries, cherries when he could find them, raspberries. Morning snack, a piece of watermelon or half an avocado with lemon and salt. Lunch, a colorful plate with plenty of vegetables, lean protein, brown rice, and fruit for dessert. Afternoon snack, natural pomegranate juice or green tea with some walnuts. Dinner, lighter, vegetable soup or salad with eggs, and fruit for dessert. And 3, things he had to eliminate. Soda, packaged cookies, and white bread. Just those 3. He thought I was crazy. Doctor, you want me to stop eating bread? I explained that he could eat whole grain bread, The real kind with seeds and grains, not that soft sliced bread that seems like cake. He agreed to try. His daughter committed to helping with shopping and meal preparation in the first few days. The first 2 weeks were difficult. He missed the sweets. He missed the soda. The pain had not improved much yet. He called me discouraged, saying he thought it was not going to work. I asked for patience. I explained that his body had decades of accumulated inflammation, that it was not going to reverse in 14 days. I asked him to continue for another month. In the 4th week, the first change appeared. He woke up on a Saturday and noticed that his hands were less swollen. His fingers no longer looked like sausages. He was able to close his hand completely, something he had not done in months. He sent me a voice message crying with joy. "Dr. Crosden, I was able to button my shirt by myself today. You have no idea what this means to me." In the 6th week, the morning stiffness had decreased from 40 minutes to 15. He could get up and go to the bathroom without waiting for his body to unlock. His knees still hurt, but less. He could go downstairs holding the railing, but without that excruciating pain from before. In the 2nd month, we did new tests. The C-reactive protein, which was at 12, had dropped to 6, still elevated, but half of what it was. The erythrocyte sedimentation rate had also improved. And most importantly, he had been able to reduce one of the anti-inflammatory medications with the authorization of the doctor who was following him along with me. From 7 pills a day, he went down to 5. 3 months later, Harold walked into my office carrying a bag. "I brought you a gift, doctor." He took out a container from the bag. "Apple pie," he said with a proud smile. "I made it myself. Mixed the dough, rolled it out, put it in the oven, took it out. All by myself." My hands obeyed me. I could not hold back my emotion. After 20 years in this profession, I still get emotional when I see a patient get their life back. He told me that the previous week he had gone to the grocery store alone for the first time in 2 years. Carried the bags, chose the fruits, chatted with the cashier. Simple things that for those without pain seem trivial, but for those who live with arthritis are enormous victories. His pain did not disappear completely. Rheumatoid arthritis is a chronic and complex disease. He still takes medication, still has worse days, but his quality of life improved in a way he thought was impossible. He went back to cooking for his family when they visited. He went back to woodworking in his garage, which was his hobby before the disease got worse. He went back to having hope. By the way, if you want to learn more about this topic of nutrition and joint health, I left a link in the pinned comment and in the description. There is additional information there that might help you. If you are interested, check it out later. Now, an important warning. Nothing I said here replaces medical care. Rheumatoid arthritis, osteoarthritis, gout, all of these diseases need correct diagnosis and professional monitoring. Medications have their place and are often essential. What I am showing you is that nutrition is a powerful tool that can work alongside conventional treatment. It is not for you to stop taking your medications and just eat fruit. It is for you to include these fruits in your routine while continuing the treatment your doctor prescribed. You have 2 choices now. The first is to continue the way you are, taking the same medications, eating the same things, getting the same results. The pain will continue, probably get worse over time, and in a few years you will be more limited than you are today. The second choice is to start making changes. You do not need to do everything at once. Start with one thing. Include strawberries at breakfast. Just that. For 1 week. Then add another change. Replace soda with water and lemon, then another. Try eating cherries a few times a week. Small steps that add up over time. Imagine yourself 3 months from now being able to do things that seem impossible today. Holding your grandchild without pain. Climbing stairs without having to stop in the middle. Waking up and getting out of bed without that half-hour wait. This is possible. Harold achieved it. And you can too. Text this video or share it on Facebook with that friend who is always complaining about joint pain. With that neighbor you know suffers from arthritis. With your brother, your sister, your friend from church who takes handfuls of medication and does not get better. You can literally change someone's life by sharing this information right now. Thank you for watching until the end. Take good care of your joints. A big hug and see you in the next video.